Should I say the speaker at this time needs no further introduction? I am Bill Bach. I am with the Department of Physiology and Health Science, and the subject of the second general session would be incidence and prevalence. In our introductory discussions yesterday, we talked about the drug addict as a portrait of a drug addict, briefly said something about the historical basis for drug abuse in this country. We're getting specific now and talking about incidence and prevalence, the number of cases. I think probably it will help us to firmly establish the need for education in this area by citing incidence figures. What is the prevalence of drug abuse? So I think Dr. Frazier and myself, our purpose will be to cite the facts and figures, the statistics that point to the important problem of drug abuse. So the title of our discussion at this time is An Epidemic of Drug Abuse Among Students. An epidemic of drug abuse among students. A great deal has been written in an attempt to define the word epidemic. Perhaps much more has been said about the widespread abuse of drugs among students today. In the study of communicable disease, for example, an epidemic is ordinarily defined in terms of the number of cases involved, the number of cases. And so we will all agree that a reliable index of need would be the number of cases or actual incidents of drug abuse or drug usage. And so we must look at the facts and figures to substantiate or verify the importance of the problem of drug abuse. Now, we may not have a problem if the figures showed we had such a low rate. There's a great deal of speculation in this area. But notice that I said again and emphasized drug abuse. By this we mean the use of any drug with dependence potential. The use of any drug with dependence potential for other than legitimate medical or research purpose. The use of any drug with dependence potential for other than legitimate medical or research purpose is the concept we want to throw out for drug dependence or abuse. And so this would include the periodic use of marijuana as an example, as well as the continuous use of heroin. So included in our concept is periodic and continuous. Now, what does a look at the statistics of drug abuse show? And in reviewing the various sets of data, our single purpose shall be to identify several important indices. Our purpose now for the next 40 minutes will be to review several important indices of drug abuse. And I'd like to illustrate my talk with a series of slides so that you can graphically see the things we're talking about. Our sources for this discussion include books, special reports, professional journals, and the like. A great deal of literature available. For any of you who are interested, we shall be happy to provide a bibliography of these resource materials for further study and review. So we're going to look at a variety of resources in presenting our various sets of data. Next slide, please. Historically, we can begin in this country with the post-Civil War period. Our second speaker in this seminar very adequately covered the historical basis of drug abuse. Within the lifetime of our grandparents, we saw the highest incidence of drug abuse in the history of this country. Dr. Mackey talked about the advent of the hypodermic needle as a case in point, and the use of dangerous drugs or drugs of abuse in patent medicines. And these two things forged a chain of approximately 200,000 known or recorded drug addicts in the year 1900. So as, let's say, a beginning point, 1900, we had an active roster of known drug addicts which totaled 200,000. This would figure out to a rate of more than 25 drug addicts per 10,000 population in 1900. Now, if we compare that figure today, the rate today per 10,000 population would be less than 3. So let's begin at the outset to look at things in perspective. In terms of the actual number of drug addicts today, we have far fewer than we did in the year 1900. In other words, in perspective, serious drug abuse was greater in 1900 than it is today. Next slide, please. Following 1900, various legal controls and court decisions helped to curb this early drug abuse, as shown in those first figures. Federal, state, local laws sought to control the production, manufacture, the distribution, the sale, and the use of abuse-potential drugs. For example, the Harrison Act of 1914, a federal law, specified that only physicians could dispense narcotics, which are drugs that induce sleep, and that pharmacists could sell drugs only on written prescriptions. And it was 1914 that these two basic methods of controlling drugs were instituted in this country. Next slide. With this background information, the first index of drug abuse that we would like to offer is the actual number of recorded drug addicts in the United States today. The first index of drug abuse is the actual number of recorded drug addicts in the United States today. At the start of 1966, there were recorded more than 57,000 active narcotic addicts in the United States. The age group distribution of these recorded addicts are shown on this slide. The largest single age group would be 21 through 30, which numbers 26,000, totaling about 47% of the total. 47% of the total number fall within the age group of 21 to 30. Age group 31 to 40 forms the next largest group, with roughly 21,000 recorded narcotic addicts in the United States. This forms about 37% of the total. The next age group over 40, approximately 7,000 recorded addicts. So our concern at this point for that age group is less. This is about 12% of the total. Under 18, only 138 recorded addicts. This is less than 1%. However, under age 21, we have approximately 2,000 nationwide recorded. These are recorded. These are known active drug addicts, which forms approximately 3%. Under 21, 3%. And finally, the age group 18 through 20, approximately 1,800 recorded addicts. The same rate, about 3%, would fall for that group. So we have an age distribution here, and this is going to suggest something for us with regard to offering a solution to dealing with this problem. Next slide. Many of these known or recorded drug addicts have been seen or have been or presently are under various methods of treatment at the several federal, state, and local hospital facilities for the treatment of drug abuse. The federal narcotics hospitals, of which there are two, are now organized as clinical research centers under the leadership of the National Institutes of Mental Health. This one shown on the slide is Lexington, Kentucky facility, and it provides us with considerable information on the treatment success with drug abuse. Incidentally, the re-addiction rate for drug dependence of the opiate type, the use of heroin and morphine as examples, is estimated by officials at Lexington to be as high as 90%, which somewhat substantiates the point made by Reverend McCullough in his address talking about the re-addiction rate. So the re-addiction rate is as high as 90% with regard to the use of heroin and morphine. Next slide. The 10 leading cities in active narcotic addicts in the United States as of December 1965 is shown on this slide. The 10 leading cities. Again, a suggestion for the areas of emphasis and the kinds of conditions that surround this particular problem. New York City, without any question, leads any other city in the country for the number of recorded active narcotic addicts. 28,000 in New York City. Far exceeds any of the other cities. Chicago has 7,000. Los Angeles 2,000 approximately. Detroit 1,600. The District of Columbia 1,000. Philadelphia approximately 1,000. And the others listed are Baltimore, San Diego, Newark, and San Antonio. This represents about 78% of the total number in the United States. So we can pick 10 cities nationwide and say these account for about 80% of all the known cases of active drug addicts in the country. Next slide. Our first indice was the actual number of recorded known drug addicts in the country. We gave you some figures to substantiate that particular indice. Another way of looking at incidence figures is in terms of rates. The narcotic addict rates per 100,000 civilian population in this case at the beginning of 1966 for the several leading cities within the United States are shown on this slide. Now this rate is based upon 100,000 population as compared to the earlier rate that I gave you, which was based upon 1,000 or 10,000 population. So the point here is that let's really look at the figures and see what the base is so that we can accurately appraise the problem. Now this is a statewide distribution. The several leading states on a rate basis. New York State, we talked about New York City. New York State leads all other states with a rate of about 162 per 100,000 population. The state of Illinois is second with a 69 per 100,000 population. The state of California is third. This is quite interesting with all the research and all the activity that we have on the West Coast with regard to drug usage. The U.S. as a whole is 29 as a point of comparison. We have 3 states that are higher than the U.S. average. The state of New Jersey is 4th. Michigan is next. All others account for only 7% of the total number. Indiana, by the way, had a reported 430 addicts as of December 1965. So the state of Indiana is very low nationwide in the number of active recorded drug addicts. So as I say, another way of looking at incidence figures is in terms of the rates. Next slide. A second index of drug abuse is production and the subsequent use illegally. The production of these drugs of abuse and subsequent use illegally. Last year, for example, there were produced 12 billion amphetamines or PEP pills and the same number of barbiturates or sleeping pills. There were produced approximately 50 million tranquilizers. Roughly one-half of these drugs were diverted into the illegal market. So about half of all the amphetamines, tranquilizers, and barbiturates produced apparently were diverted into illegal channels for use. And so, as someone has said, we have an epidemic of nice drug addiction in the United States today. Next slide. A third index of drug abuse would be seizure figures. The seizure, in conjunction with the production figures, large amounts of these or those drugs diverted into illegal markets are actually seized by our law enforcement officials. In recent correspondence from the United States Commissioner of Customs, the course of heroin seizures showed an astounding increase. For the fiscal year 1966, for example, 281 ounces of heroin were confiscated. In fiscal 67, no less than 1,246 ounces of heroin were seized. This represents a fourfold increase from fiscal year 66-67. And in the first 5 months of the current fiscal year, already 1,370 ounces of heroin have been taken in. These are rather dramatic increases. Next slide. The same grim picture is true for marijuana. In 1966, 10,000 pounds were seized. 10,000 pounds of marijuana were seized. In 1967, 26,000 pounds, a 2.5 approximate increase. And so far in 1968, that is the first 5 months of this fiscal year, 24,000 pounds have been taken in. The largest single seizure of marijuana in the United States is shown in this slide. Some 500 pounds of refined marijuana were seized in Laredo, Texas in August of 1967. 500 pounds. We can see from a review of these figures a sharp upsurge in smuggling of dangerous drugs into this country. Next slide. No doubt the most widely discussed and observed drugs of abuse are marijuana and LSD. Several studies have been conducted in this area. We should like to briefly review 2 illustrative studies to give you an impression of the available statistics. Therefore, a fourth index of drug abuse would be valid studies on the use of abused drugs. The valid studies that are available, and we have 2 illustrative studies that we'd like to review for you. Next slide. The views of college students on drug taking was the subject of a study conducted by the American Institute of Public Opinion in 1967. The views of college students on drug taking was the subject of a study conducted by the American Institute of Public Opinion in 1967. A total of 520 interviews were conducted with a national sample of college and university students. An approximate equal number or distribution of sex and age groups were found in the sample, and this slide illustrates for you the sample distribution. The next series of slides will review the major findings of this study. Next slide. There were a series of questions were asked the people in the survey. The first question, just your best guess, what percentage of college students in the nation as a whole would you say take drugs such as LSD or marijuana? This slide shows you the frequencies of response. The single most important response, most frequent response, was 10%. The frequency of this response was 15. In other words, 78 of the 200 or 520 people felt that approximately 10% of university students nationwide have used drugs such as LSD and marijuana. This is simply asking people. You can immediately observe the validity of this study, or make a comment about the validity. This is one type of study, by asking people how they feel. What impression do you have? Do you know people who have used LSD or marijuana? The median average response was 13%. Next slide. The second question, just as your best guess, what percentage of college students in your own college, Ball State University, would you say take such drugs? The range was from 0 to 75%. Some people felt up to 3/4 of students in their university or college took these kinds of drugs. The largest single response was 1%. And the median average response was 4%. And so this, probably the most often, most frequently quoted figure on the number of students using psychedelic drugs, which include marijuana, would be 4%. And this will be verified by some more reliable study, and the second one I'll talk to you briefly. Next slide. Do you personally know any students who have taken such drugs? Was the next question. Very interestingly, 50% of the men and 47% of the women said they did know personally of some student who used these drugs. Under the type of college, the largest single group that said yes was the private college. That might say something about the characteristics, some of the characteristics of students who attend this type of institution. 62% of those respondents in the private school said they knew of people who took psychedelic drugs. Next slide. Have you yourself ever tried marijuana or LSD? 6% of the men said yes, 4% of the women said yes. The national average would be 5%. We have roughly 6 million university students in the country today. If you want to project this 5% to the 6 million university students, we come up with a figure then of about 300,000 nationwide students who have used psychedelic drugs. The basis for that figure then is that the 5% times the 6 million would give you 300,000, roughly, the number of students who have possibly used psychedelic drugs, including marijuana, at least one time. Actually, there's a difference, because I should correct myself. That 300,000 would be marijuana, because we have a separate category for LSD. Let me make sure we have that correct. It would be 300,000 marijuana users The 1% is the figure for LSD. 1% was the national average to the question, yes, I have tried LSD. 1% of the men, 2% of the women, a national average of roughly 1%, times 6 million, again, projected figure, gives you 60,000 who have tried LSD. So with regard to the psychedelics as a whole, we have 360,000, let's say, at least users of one time, based upon this particular question. Again, you could easily challenge that figure, but we're simply taking one study and using that to project for another figure. Next slide. Next question on the survey was, what do you think are the main reasons that college students take drugs? And this gives you a listing of the main reasons suggested. I'll just say that most of them felt that it was out of curiosity to try something new, a new kind of experience. 38% of the people felt this was the reason. 28% check the example for kicks, makes me feel good, intoxicates. 19% to escape from reality. Reverend McCullough talked about the escape mechanisms. The reason that he used drugs was to escape from the problems he faced. So the large portion fall within those three examples, and there are others. A typical verbatim comment on this question by students would be as follows, quote, "This is an answer to the question, what do you think are the main reasons that college students are taking?" And these are several typical verbatim comments, quote, "They are looking for something, but they have no idea of where to look. They're all mixed up," unquote. This is from an 18-year-old female from Geneva College, sophomore sociology major. Another typical verbatim comment, "All their friends do it, and they want to be accepted into the crowd. They don't want to be regarded as chicken." It's a rebellion against society, an escape from reality. And I could go on and read, but these are the typical comments to support the reasons for those first three statements. Next slide. They also ask, do you think that the taking of drugs is likely to increase, or do you think it's a fad that will die out? The trend is easily shown on this slide. 67% thought it would increase. The nationwide educational effort certainly indicates that this is true. We're certainly geared for the worst. It's going to get worse before it's going to get better. Apparently the students feel this way too. So you look down the line, it doesn't make any difference, the age, the polytech, the education, or the type of college, they all seem to feel that the use of drugs will increase before it will decrease. Next slide. Why do you feel this way? That is, that it will continue. Some people felt because of more tensions, pressures on kids today. It's an escape mechanism. It's new. It hasn't reached its peak yet. More people want to try it. It's becoming easier to get. More will have access to it. The problem continues to worsen, and it doesn't appear to be diminishing. A typical verbatim comment to substantiate this question is, why do you feel this way that drugs will increase? The kids don't realize the dangers are facing them by taking drugs, and they go on taking them. It hasn't reached its peak yet. It will continue for quite a while before the ways are found to regulate it. And finally, drug taking is becoming more and more popular, and more students are using it to reduce pressure. Next slide. Now, why do you feel this way that it will fade out? 18%, as you will recall, said that it would fade out. It will die. Some felt that something else will take its place. These are the other responses. Some felt that they'll find that drug taking has harmful after effects. I think probably most people that take drugs know that. There's more than just telling them that involved in education. The example of typical verbatim comment for this small percentage is, I quote, "It's temporary. One tries it because a friend has tried it. It's a form of conformity," unquote. The students will soon come to their senses and realize it's harmful. Everybody's doing it now. As soon as they find out it's harmful, it will stop fast. Typical verbatim comments in answer to the question, why do you feel this way, that it is a fad that will die out. Another question, next slide. What is your mental picture of the type of college students who goes in for drugs? In other words, how would you describe the person who uses drugs? 30% said the arty type, sloppy looking, long hair, beard, sandals, blue jeans, weird types. 30% also said a mixed up kid with emotional problems, troubled, insecure, unable to adjust. There was even an indictment made for intelligence as being a factor. But we have stereotypes of people which may not be accurate in assessing the use of drugs. And I think we can point out in the second study that these stereotypes in many instances are very inaccurate. But on describing the kind of person who is a drug user, a typical verbatim comment would be a person who needs help and needs it badly, lost, mixed up, sick, obviously unstable. An 18-year-old female from Barnard College, political science major, sophomore, said, unquote, "I don't think you can put them in any one category. They come from all walks of life," unquote. That's probably the most accurate assessment of a drug user. You can't put them in any one category. They probably come from all walks of life. Next slide. If you were a parent with a son or a daughter at college, what position would you take in regard to the use of drugs, such as LSD and marijuana? This is the last question asked the respondents in the study. Without question, everybody would oppose it. They would strongly be against it. 52% of the people felt that way. They certainly would be warned of the dangers, discourage their use. They wouldn't encourage it, but they would let them decide for themselves. I think there are some elements in these questions that might help us to further understand the problem of drug abuse. These views of college students on drug taking can be used as, let's say, a general index of drug abuse by students. Next slide. This information should help give us clues to help identify the areas which need attention and further research. A more specific study of drug use was conducted by Rand and Hammond last year at Ithaca College in New York. Because of the time limitations, we'll just briefly present the results of this study. Ithaca College has a student body of 3,200. A total of 2,145 survey forms were used, which totals out to about 75 or 70% of the total student body at the college. Next slide. Now, marijuana is the illegal drug most widely used among college students. The question of actual frequency of marijuana use creates the greatest speculation. This table shows the percent of students who have ever used marijuana at this one very specific college, Ithaca, New York. Very interestingly, it shows several things. The use of marijuana by sex, class, and major. The percentage of usage was approximately, for all classes, didn't make a bit of difference whether you're freshman, sophomore, junior, or senior. The percentage for usage in this particular instance was about the same. And you can see them across the bottom of the slide. 28%, 28%, 25%, 27%, and 28%. Right on down the line. There's the average figures. The sex difference was always in favor of the males. The men always were found using marijuana more frequently than the females. In this very specific study, there was a factor of major. What your major in the university or college was some bearing upon whether or not marijuana was used, or at least indicated. The highest were the liberal arts majors. Liberal arts and speech, radio, TV had the highest incidence of usage of marijuana in this particular study. The lowest was physical therapy and physical education. Now, we're not making an indictment for one or making a praise for the other, just simply observing that in this very specific study this was found to be true. The concept of social contagion or peer group spreading of the disease is indicated under speech pathology, or speech as a major, in which entering freshmen and sophomores had very few, and apparently there is some suggestion that as juniors and seniors, because of the peer group usage and the way in which marijuana is used in the peer group, might account for the fact or the reason why there was an upsurge of use in marijuana at the junior and senior year in its one very specific major, speech pathology. But at least we can suggest that for your consideration. Next slide. This slide shows amphetamines, the pattern of pep pill use, and shows that it's very similar to marijuana in Ithaca College. More males over females, little difference among the 4 academic years, and again the liberal arts turn out to be the highest. Now, the classification of illegal amphetamine use is traditionally broken down into 3 categories. The classification of illegal amphetamine use is ordinarily broken down into 3 groups. Group 1 is the use for sleep-inhibiting qualities. The use of amphetamines for sleep-inhibiting qualities, and in terms of a practical situation on the university campus, exam time, or driving long distances, returning to school or going away for the weekend. Category 2 would be the use to potentiate. Now, I'm going to explain that briefly, but the use to potentiate some of the psychological effects of illegal drugs. And potentiate means to heighten or increase the effect of one drug with the use of another drug. Reverend McCullough, again our speaker on drug usage, talked about combining one drug with another. And the interaction of one drug with another is probably the subject of a great deal of research today, and the phenomenon of potentiation, the heightened effect of one drug when added to another, is a category for the use of amphetamines. That is, it is used to potentiate some of the psychological effects of illegal drugs, i.e. marijuana or LSD. And finally, sometimes in student usage, it's used to produce simply a high for intoxication purposes. But this particular study did not differentiate the above types of amphetamine users, simply showed that there were more males over females, little difference among the 4 academic grades, and some indication that the liberal arts majors in this school were highest. Next slide. The same thing was done for psychedelics, barbiturates, opiates. All other drugs were studied in the Ithaca investigation we can make this study available for you if you'd like to look at it in detail. But the point I'd like to make is that the illegal use of these other drugs, the psychedelics, the opiates, and the barbiturates, it's about the same as the pattern for the other drugs shown to you. A very low rate of usage, and perhaps our figure of 1% is even too high in projecting it on a nationwide basis. Next slide. The question was raised as to the current drug use. The prior 3 slides identified students who have ever used the various categories of dangerous drugs. More relevant to the present pattern of drug use is what's going on now. What are they currently doing? Current use is defined in this study as being the drug in question, using the drug in question at least once during the 3-month prior period. That is, using any of these drugs at least once, the 3 months prior to the study would be defined as current drug usage. The former use then would be not using a drug, any of these categories, during the 3 prior months. And this slide simply indicates that with regard to marijuana, for example, with regard to marijuana, and we have psychedelics and marijuana shown on this slide, the same thing was done for all the other categories, the opiates, the barbiturates, and the amphetamines. The current use is in the dark column, the former use in the light column, and in every instance you can see current usage is pretty high, and the percentage is indicated on the left. To simply show you in the right-hand column, the current usage of marijuana at this particular school is 17%. It would be interesting to find out what the current usage of marijuana is at this institution. But at 17% current usage of marijuana, roughly 2% the psychedelic drugs. So the former and the current usage of psychedelic drugs is about the same at Ithaca College. This study was conducted last year. Next slide. Now the frequency of current usage, that is again the last 3 months, is the subject of this slide. This shows that most students are using drugs to satisfy curiosity or in response to momentary social pressure. This tells you the frequency of current use. Without question, marijuana leads the list on the frequency of current use. The amphetamines compared next, the sleeping pills next. Most students have no problem sleeping. They don't need pills to sleep. The psychedelics would be third, and the opiates would be fourth. And so, without question, marijuana leads the frequency of current illegal drug use. This particular study, interestingly, covered both Thanksgiving Day recess, or Thanksgiving recess, and Christmas recess, so there was really no way of telling how much drug usage was practiced over a vacation period. And maybe that accounts for the high incidence of marijuana usage. Next slide. Probably the most important finding of the study was the question of initial drug use. In other words, when did the students start using drugs first? And really important factor was that before college was the practice of many drug users in this study. Broken down into your classes, 60% of the opiates were, or 60% of the students used the opiates before they came to college. 57% of the barbiturate users before college, 42% of the psychedelics, 29% of those people who used marijuana used it before they came to this particular college, and 26% of the amphetamines users before setting foot on campus. Now, this simply shows that a dangerous period, a more dangerous period, is during the pre-college years. There's very limited study available for actual drug usage on high school campus, if you will. But this kind of indirectly identifies what happened in high school, and the subject of art education and the importance of education is illustrated, I think, on this slide. And so the purpose of our afternoon work sessions in this seminar will be to develop teaching materials for the junior high school level. And so drug use at college is strongly influenced by students entering college with a fair amount of experience in the use of illegal drugs. So here we've got students coming on campus and they've got a little experience in know-how, and this probably influences the students coming on campus. And so you can see the percentage is illustrated in this slide. Next slide. The anticipated future use was the subject of this question, and most students expected a continual, fairly heavy use. The majority plan to use it again in the future. In terms of the actual number, there are about 385 students who have used marijuana and plan to continue to use it again. That percentage is the number figure. 385 students who have used marijuana plan to continue to use it. Another 289 students who have never used marijuana but anticipate that they might use it again in the future. So we've got two groups here, the users and the non-users, who are potential users that need to have some discussion. So the anticipated future drug use is an important aspect of the problem in discussing this with young people. Next slide. Now this is an example of a very specific study. It was an anonymous type thing. Nobody was coerced into answering any questions. They were able to respond, so I think probably maybe a little bit more reliable than the first study suggested for you. It described the experiences of students with the 5 basic categories of drug use. And for that reason, we suggest that it can serve as a reliable index of drug abuse among students. So we'll add this to our other indices, the number of recorded drug addicts, the production figures, the seizure figures, the general studies, and the specific studies as being indices of drug abuse in the country. Next slide. And so I can say in conclusion and summary that the problem we have to face in drug abuse is suggested as being nationwide in scope. The Federal Bureau of Drug Abuse Control has nationwide centers which attempt to identify and provide assistance in this area of drug abuse. The fact is, we have this new organization known as FDAC, the Federal Bureau of Drug Abuse Control. And we have nationwide organizations set up to deal with the problem. Now, these statistics present a clear picture of the incidence of drug abuse of young people. Our other speakers will help to further define a dimension of the drug abuse problem. And we consider the first and the most important step in dealing with drug abuse to identify the problem. We have done this with some statistical information. Our next step will be to get into the specific aspects of the problem, the sociological aspect, the psychological aspect, the legal aspect, the moral question, and the question of education. Well, that concludes my presentation.